them right there. We can see that. I'm gonna go right over. Make sure I'm not hurting you. Okay, just make sure though I'm not. I know
a little bit.
that was hurt. I thought you jumped there.
Sorry.
I know a little underneath. Sometimes I need numbing. If you say a little bit, that means a lot though, because I know that. Because you're tough. Let me just put some numbing right under here. This goes underneath a little bit, so a little bit pinchy maybe. Just don't want to inject into the cyst so much, because that's when it squirts me. But now it's okay. It's true. So, but now it's okay since I already made a little incision there. It won't squirt me so much. Okay, I'm gonna give it a little squeeze now just to see if I can get it out. Yeah, there's cyst under there. Gotta push against you. See, I think we got a lot of it. Am I hurting you? No, right? Okay.
No.
Just gotta push against you here. See if we can get it.
Do you want me to do this or?
If you just sit with that, I'm just gonna push against you. Just don't,
Okay.
don't fold over, I guess, into yourself, which it looks like you're not going to. So I'm just gonna lift up and see if I can squeeze anything. Not really. And again, not hurting. Okay, good. Just see if I can get some of that cyst out here. We can get it all right. Still not hurting.
No.
Okay, good. This time I'm using a little curette to see if I can scoop it here. So I know you've had this squeeze before, and the thing is that it'll keep coming back as long as there's still cyst contents there. Why did you want to get this removed anyways? Does it really bother you?
I'm tired of it.
You're tired?
I'm tired of it.
Why? What does it do?
I've had it for years and years.
But what makes you, because you don't even know, I mean, I would think that it's just back here just kind of hanging out with you. It's not really doing too much.
You know, I in the summer, you know, as fat as I am,
You are
I
not.
wear little sundresses that are, that's the only thing I show on me is just.
Do you feel like people are seeing this?
And I know it's above that line.
Yeah, but do people point it out to you? Not necessarily.
But
Yeah.
just that lump back there, it's just like, I don't like to see that on people.
Oh, I see. But I will tell you, this is pretty small and pretty insignificant looking.
Oh, good.
So I hope that this gets rid of it. I do think it looks pretty clean, but I'm gonna sit up a little bit more, like straight. Yeah, there it goes, just so that it's loose. I could just make sure, feel around here, make sure it looks like it's all gone. Let me do one more little look, and it looks pretty good. It was pretty small, but I believe you that it gets bigger. I tried to take out the little punctum, so.
Years ago when I used to have more money, I used to get a back facial after my husband passed away. My husband used to check my back out.
Oh, yeah.
Then about every couple of months I'd go and get a back facial, and she'd drain it every 2 months.
Yeah.
She would say, "It's that big bad boy."
She probably looked forward to that, huh? Do you think so?
But then after what I went through over Christmas, it was so huge.
It was, and you don't want it to happen.
And it was draining on my bed and on my clothes.
Oh, goodness. Yeah, it sounded like it was inflamed then.
Yeah.
I bet you a lot of it got a lot smaller after that though, huh? Don't you think?
Well, I can't see it very well.
Okay. You just know it's been big before.
Definitely, yeah.
Well, I think hopefully that wasn't too bad. I think that the fact that it got inflamed before, I bet you that helped to get rid of a lot of it, and you just had a little bit left. So I think that this is going to get rid of it. Okay. So 2 little stitches here, most likely, and we'll take those stitches out in 10 days.
Okay.
I'm gonna do it straight up and down because I think that's gonna hopefully do less with stretching of the scar or anything, less scar line there. There's gonna be just a little fine line there.
So how do I treat that now?
Oh, it's very easy. All you have to do is just put a we'll put a Band-Aid on there, and you can leave it on there for as long as you like. Do you live alone?
Uh-huh.
You know. closer. He won't.
No.
If it gets on you, he's yours. You got his
like
cuties
that.
already. Oh, you don't. This is a punch. See, we just make a little. We make a little cookie cutter right there.
Yep.
You're feeling okay, right?
Yep.
Over there,
I'll let you know.
Okay. I think she might be hooked.
Wow.
No, I'm not sure if she's hooked or not yet. So there's the contents right there. You see, and there's a cyst under there. The cyst wall. There's the top of the skin that we removed. But see how it kind of comes in. It comes in pieces because we're trying to remove it out of a small little area.
Oh, wow.
Sometimes you can take the whole sac out, but you have to like really make it a wider excision here to do that. Let me squeeze you real hard and see if there's any more underneath there. Sometimes when a cyst has been removed before, though, too, it comes back just because it's like it's hard to, you know, it's hard to get it out completely, and it's been scarred, you know. So there's like cyst contents that are still stuck under there and that can reform. Then I'm just gonna scratch around here. I'm not hurting you, right?
Like the hole punch thing. I wonder if that's what they did on the bottom of Scott's foot when he had a plantar's wart. Because it looked like the size of an eraser, and it was a hole that was like.
Really? Yeah, that's probably it then. But we don't usually punch the box. At least we don't here. I mean, I guess you could do that, but we don't here. See, I'm starting to use a curette, which I think is going to be helpful. Pull up your shirt a little bit here, just to make sure we got it all. I think there's still something right there, perhaps.
It's a good thing you have good eyes.
We try. Except sometimes I need to wear a guard because we get splash in the eyes. Isn't that gross? We actually have an abscess next door that we got to do. It's like an infected one. It's bigger. It's gonna squeeze out.
I think that's what happened with my mom.
Yeah, you got an abscess.
And then she
You okay?
misunderstood what the doctor said, and she thought like we had to like keep working on it like every.
Oh, squeeze it at home?
Yeah,
Oh, yeah, that's
like
gonna
every
get infected then.
2
Yeah.
hours. So I was getting up in the night. She stayed at my house, and it got to the point where I was nauseous because so much stuff was coming out of it. I thought,
this is not right, kind of thing.
okay, I'll stick a piece of bread in my mouth, and that actually helped to keep me from.
That's quite a sight to see.
I don't know. And then when she went to the doctor, he was like, "That's not what I meant." Oh, she has a huge scar on her back.
Oh, you see there? See there's a little bit of sac wall. See that? See how it's like a little gray, like a little different color? Do you see that yourself?
No, I can't because
I guess we do because
my
we see
eyesight's
that a lot.
not as good as yours.
Well, there's a little sac wall right here. It's hard to grab. And these forceps stick right there. Not too bad though. You're okay, right? Now that we're doing it and you're not in pain, you're okay. Right, sweet? Right, patient? Okay, I'm glad he's snoring. Sometimes we challenge ourselves. We try to get out a really small hole, and it's not so easy. Oh, we got to show her some of our Instagram photos now. She'll get into it. There you go. So now I'm going to put 2 stitches there, and you can take it out yourself. Well, you can have him come in. He's only here since you guys are close by. Yeah. You can have him come in, but it just comes out in like 10 days, 10 days. You can just take, it's like probably 2 stitches right here. 2 stitches. You just have to, lift it up and then take 1 stitch off. You know what I mean?
Very good.
Now it should be nice and flat, and hopefully it won't cut back. I mean, I will tell you that there's always a little chance, especially if it's been squeezed before, that there's a part of the sac still there because it's been fragmented, and so that can make it come back. But,
I see.
You know what I mean? But see, it's nice and flat now.
Yeah.
Good. That's it. Did she like it?
She went to Vegas. Yes.
Yes.
She did.
And share too. It was nice. She's good. She's a good entertainer. A little poke in these. These are open comedones, but I think a little poke will help. And it's so slight. Okay, one right here on this one. Here, you got this one right here. Okay. There we go. That's a nice one. This one too. Wow, that was actually bigger than expected. Good. So maybe I won't have to. Now that I know she grows kind of big ones under there that come out so easily. Let's see if I. No, I gotta make the skin. Cotton. Oh, these are stubborn, but they're coming, just stubborn. There we go. This one below is stubborn. There we go. Okay. That one was stubborn but satisfying. We got it. Okay, a couple little ones on this side. Pinch here. Sorry about that. There we go.